Welcome to the WTR Biotech Spotlight podcast. I'm your host, Tim Gerdeman, Vice Chair and Co-founder and Chief Officer of Water Tower Research. In today's special podcast episode, I'm being joined by my colleague and Senior Research Analyst, Do Kim, to discuss the Trump administration's most favored nation prescription drug pricing plan announced yesterday. Good morning, Do, and thank you for joining today's podcast.
Always glad to be here, Tim.
So, Do, kind of to kick things off here, yesterday, Trump signed an executive order called Delivering Most Favored Nation Prescription Drug Pricing to American Patients, which he has suggested could lower drugs by 30 to 80% almost immediately, and that U.S. prices could drop by as much as 90%. What is most favored nation pricing, and how does it cut U.S. drug prices by that much if it actually plays out like he suggested?
Yeah, great question. First, I think to set the stage, most favored nation is this proposed policy that biotech and pharma investors have gotten to know pretty well. It's a concept borrowed from international trade where countries agree to treat their trading partners equally. And when you look at that for drugs, it means to use international reference pricing to set US prices at the same level, at the lowest price in comparison to similar developed countries, talking about on similar economic levels. And when you look at these countries, their drug costs are considerably lower than in the US. It's fairly well known that the US has the highest drug prices compared to other countries. Looking at the European Union, the same branded drugs here in the US, they're priced around 40 to 60% lower. In Canada, you have some drugs that are about 50 to 80% lower. And the reason for that is we don't have universal healthcare here. It's a free market system, while almost every other country has government-funded healthcare that negotiate drug prices. And there's a trade-off when you think about that. Like, the government places more restrictions on who gets certain drugs, and it could sometimes take years to have those drugs available when it's already accessible in the US. And those are the things that you think about when you have the higher drug prices here in the US and drugs costing lower in other places.
Yeah, that's a good point. It's certainly a very tricky trade-off, which I could come down on either side of that one, I suppose. So moving on the surface, that would seem to be very bad news for pharma companies, and yet many of their stock prices climbed yesterday. Is that a reflection of the broader market rally yesterday, in your humble opinion, or is there something else to it that is counterintuitive, given the pricing pressure they would face with this executive order?
Yeah, I think the broader market rally helped the pharma and biotech sectors, but I've seen and we've definitely seen that biopharma trade in opposite directions of the macro environment just because of what's going on with the industry. And what happened in the prior week before Trump made this executive order, Politico, the news outlet, put out from inside sources that Trump's big announcement that he was going to make was to bring back the most favored nation. So this was widely expected ahead of Monday's executive order. Pharma and biotech sold off pretty heavily last week. It was one of their most down weeks that we've had in 10 years. But like I put in my weekly report, the question is, how will Trump make pharma companies cut their prices? And if we have gotten an actual well thought out and fairly comprehensive plan of action, that would have definitely pushed pharma and biotech lower on Monday. It would have diverged away from the overall market. But generally speaking, when you look at this executive order, it lacks substance. There was no clear path on delivering on this most favored nation drug pricing, no framework on what drugs will be impacted, what countries will be used as a reference for these prices, and exactly where will Trump get this authority to make the pharma companies lower their prices. If he wants to reduce prices for the what the government pays for Medicare and Medicaid, he has some control over that with Congress, but he also wants to lower commercial drug prices. And an executive order just doesn't have the power to force lower commercial prices. And from what I gather from this order, there's just no plan that could immediately lower all drug prices by 30 to 80%. And that's why biopharma regained the losses that they had in the prior week.
Yeah, that all makes sense. I did read multiple articles today suggesting that this is likely to be mired in lawsuits for years to come anyway. So if we move on, just to wrap up, if the executive order lacks any real authority to lower drug prices, what could happen with this MNF policy in your opinion, Doe?
Yeah, so I think overall, the claims of 90% price cuts are not going to happen. First, Trump wants the HHS RFK Jr. to negotiate with pharma companies to voluntarily lower drug prices to most favored nation levels. And if they don't, I don't think they will just by asking them to. Trump has put in and stated several, let's call them threats to make them comply. Remember, I said Trump is bringing back most favored nation? He tried this at the end of his first term, and it was blocked by the courts. So I expect, like you said, a lot of legal challenges from pharma to stop Trump's actions. And he had stated during the presentation of this executive order that he wants to reduce Medicaid pricing, but that requires an act of Congress. And he tried to put it in the reconciliation bill, and the Republicans actually rejected that proposal. He's threatened to mess with pharma's drug patents, and also he said that he will make it harder for them to do M&A deals. The easiest path actually is for them to go through the existing law around Medicare negotiations that was placed by the Inflation Reduction Act. But I still think there's legal issues there that will prevent international reference pricing. There's also a part where he wants other countries to raise their drug prices, but I don't see how our government could control that. Other nations are constrained by their own budgets, and the ongoing trade war just makes it a little more complicated. The executive order lowering drug prices immediately, I think consensus, and in my opinion, is there's a lot of smoke right now, but he seems fairly strongly committed to doing it. That means he has some time to figure a process out, and maybe that time will expire when midterm elections happen, but we'll keep an eye out for more proposals to potentially lower these drug prices.
Great. Those comments are really helpful. So thank you for letting us glean insights into how you're thinking about yesterday's prescription drug executive order, Do Kim. Also, a special thanks to the producer and editor of the podcast, my WTR colleague, Joe Brunetto. Thank you for listening, and don't forget to subscribe, as well as visiting www.watertowerresearch.com to stay up to speed on the company's small cap written research reports, podcasts, fireside chats, and conference schedules. We will see you next time for another edition of the WTR Biotech Spotlight podcast.